Hello, my name is Deborah Ryder. I'm enrolled in Ashford University, Introduction to Healthcare, HCA205, Instructor Nicole Loshaw. Today's date is February 1st, 2015. The topic of discussion today is the introduction to the United States healthcare. The main goals of my presentation are to review the U.S. healthcare system, identify major developments that have transformed the United States healthcare system to what we know it today, and to discuss the stakeholders and their roles. I will also be discussing the cost associated with the U.S. healthcare system, how they are set, and explain how technology has affected and continues to affect healthcare costs. And review and compare the United States healthcare with Canada and discuss the Canadian healthcare system and compare the Canadian healthcare system with the United States. And part 4 of my presentation will discuss potential reforms and improvements that are currently being considered or recently implemented. And then in my conclusion, I will be addressing and discussing where we will be in 5 to 10 years and what our future looks like in the U.S. healthcare system. An introduction to the United States healthcare system. Part 1, the United States healthcare system overview. To discuss the historic events and identify major developments that have contributed to what we know our medical system to be today, and to discuss the stakeholders or the contributors in the medical system. The American healthcare system has evolved throughout history and continues to change and revolutionize during modern times. There are many contributing factors that have influenced the United States healthcare system and our medical practices and beliefs. Beginning in the early 18th century, the knowledge of viruses, bacteria, and cell structure did not even exist. Physicians did not practice clean or sterile techniques when operating or treating patients. Anyone could claim to be a healer or a medical doctor, and there was no formal education or training standards in place. According to Beninsky, Hayes, and Bennell, 2014, only 10% of practicing medical doctors actually had formal education and training. In the early 1700s through the mid-1750s, or the colonial period, Western or conventional medicine was introduced to the United States by the European settlers. An example of Western medicine practices is to drain a person's blood to get rid of illness or disease. Western medicine focuses on identifying, treating, or abolishing disease or illness. Prior to the European immigration, The Native American Indians occupied the land, and they had their own beliefs and medical practices that included homeopathic herbal remedies and treating the body, mind, and spirit as one. During the 1800s, the American Medical Association was founded. The AMA had the intent of standardizing medical doctors' formal education and training. Also, the mission of the AMA is to support advancements in medicine as an art and science and support the community or public health. Because of the AMA's push for education and training, physicians today are required to receive many years of formal education and training and are also required to take exams for licensing and credentialing and to become board certified. In fact, all healthcare clinicians are required to receive formal education and training and pass entrance exams for licensing, depending on the state that they reside in. The AMA also has paved the way for evidence-based, standardized, and best practice medicine. In the late 1800s, the first military hospital was built after the Civil War in 1865. The first organized military hospitals and healthcare facilities were built around the country. Due to the war, many people migrated and relocated to urban areas for employment, thus sparking the creation of the first government-funded healthcare programs and the first prepaid health insurance program in history. The American healthcare system originated from the first military hospitals after the Civil War, with such government programs as the Department of Health and Human Services. This department supports public health and has laid the foundation for many other federal organizations like the NIH or the National Institutes of Health and the Centers for Disease Control and the U.S. Food and Drug Administration or the FDA. During this time period, cleanliness standards, sanitation procedures, and nutritional guidelines were developed and implemented in hospitals throughout the country. The Department of Health and Human Services was one of the largest contributors for the need for our country to address universal health care. In the late 1800s, the first military hospital was built after the Civil War in 1865. The first organized military hospitals and healthcare facilities were built around the country. Due to the war, many people migrated and relocated to urban areas for employment, thus sparking the creation of the first government-funded healthcare programs and the first prepaid health insurance program in history. The American healthcare system originated from the first military hospitals after the Civil War, with such government programs as the Department of Health and Human Services. This department supports public health and has laid the foundation for many other federal organizations like the NIH or the National Institutes of Health and the Centers for Disease Control and the U.S. Food and Drug Administration or the FDA. During this time period, cleanliness standards, sanitation procedures, and nutritional guidelines were developed and implemented in hospitals throughout the country. The Department of Health and Human Services was one of the largest contributors for the need for our country to address universal health care. Although health care insurance is introduced by the federal government in the late 1800s, the demand for public and private insurance rose in the 1900s. There are many different categories of public and government insurances. To name a few: fee-for-service, comprehensive medical care insurance, HMOs, PPOs, and capitation. The fee-for-service is the mainstay of the American insurance model. Fee-for-service is a reimbursement model that charges the individual for treatment, services, or medication. The fee-for-service method of insurance payment is not favored today due to the lack of regulation and the association with high medical costs. Comprehensive medical care insurance model combines basic coverage with major medical insurance plans. HMOs, or the Health Maintenance Organization, was introduced in 1973. This model provides health care coverage only to participating doctors in the group. HMOs use medical doctors as gatekeepers to minimize costs and reduce the overuse of the medical system. Private and public health insurance is available to the American public, and most are provided by employers. According to Beninsky, Hayes, and Bunnell 2014, another type of insurance is capitation. In this model, the physicians or group are paid regardless if the patient receives treatment. This method also encourages physicians to reduce cost and not to overuse the medical system. The introduction of CMS, or Centers for Medicare and Medicaid Insurance, a branch off of the Department of Health and Human Services, is an example of the government initiative to decrease medical care cost. Of ways that the government aims to reduce costs are DRGs, or diagnosis-related group charges. The facilities or organizations are reimbursed per an average of the group that they participate in charges. And basically, Medicare determines the payment based on the average charge in the area. Another example of CMS insurance reimbursement is pay for performance. The intent of pay for performance is to establish payment based on performance scores. The scores are derived from factors that are related to the quality of and safety, effectiveness, and efficiency of the facility that's providing the care. CMS also funds or provides financial incentives for medical facilities that adhere to CMS guidelines and standards that improve the quality of care. Healthcare organizations that participate in pay for performance, or P4P, continually analyze and modify processes and procedures with the goal of improving the efficacy, the effectiveness, safety, and overall quality of care. There are many different types of stakeholders involved in the United States healthcare system. To name a few, there's healthcare professionals, universities and colleges, politicians, the patient, medical vendors and medical equipment suppliers, and contracted services. All are needed for the functionality of the U.S. healthcare system. There are many different types of medical field providers, ranging from medical doctors or physicians to psychologists, doctors of pharmacy, doctors of osteopath, and doctor of chiropractor. There are many other supportive bedside clinicians, such as physician assistants, nurse practitioners, bedside nurses, physical therapists, respiratory therapists, radiology technicians, and social services. Other stakeholders, as I mentioned, are university, colleges, technical schools, and affiliated professional organizations that provide and meet regulatory mandates for education requirements for certificates, credentialing, and licensing. Congress mandates the establishment of federal standards for the privacy of personal health information. Congress has also put into motion other acts, such as HIPAA. HIPAA was made into a law in 1996 and is known as the Health Insurance Portability and Accountability Act. The goal of HIPAA is to protect the confidentiality and safety and privacy of patient health information and to prevent any individual from being discriminated against while receiving or preventing them to receive medical care. Another example of legislation that supports the welfare of the American public is CHIP, or Children's Health Insurance Program, that was passed in 1997. This program was one of the largest taxpayer-funded health insurance in the country since Medicaid. And CHIP is coverage is partnered with federal and state governments to provide coverage for children for low-income families that do not obtain health care through their employees. The most important stakeholder of the healthcare system is obviously the patient. Patient satisfaction and experience scores are measured and reported to CMS. And these quality scores are then utilized by CMS for payment and reimbursement and by medical care organizations to improve their patient care and their customer satisfaction scores. Another stakeholder are vendors and suppliers for medical equipment. In diversified cities where there's diversified customers, it is important to meet the demand and the service of the culture in your community. Vendors and suppliers and contracted services all must meet organizational needs and state and federal laws. Contracted services in healthcare must follow and adhere to all organizational policies and procedures and participate and maintain accreditation during inspections. The U.S. healthcare system, Part 2, the cost of the U.S. healthcare system. In the next few slides, I will be describing the cost and how they are set, reviewing reimbursement methods, and discussing the United States healthcare public insurance versus private insurance, and how technology has affected the cost and continues to affect the cost of the United States healthcare system. Through the demands from the patient or the customer and government and accreditation agencies for high quality care, the freedom of choosing physicians or hospitals, for the demand of affordable health care, and to provide all citizens with health care and insurance. So how are health care costs determined? DRG codes, ICD codes, reimbursement methods are all part of the United States healthcare system determining cost and reimbursements for healthcare services and treatments. DRGs are diagnosed related groups. An average of healthcare facilities bills are taken by the insurance or Medicare to determine the correct payment for that service in that area and benchmark it against other facilities in the geographic area or throughout the country to base what that hospital should be reimbursed. Another form of costs is the ICD-10 or the diagnosis code. This is an abbreviated way to refer to a classification of diseases, and it's an internationally recognized method and a CMS mandate. And then their CPT codes are 5-digit numbers that are used by medical providers and facilities, healthcare workers, to link their procedure or service with the bill or the charge. And then insurance then determines the payment based on the CPT code and along with the ICD-10 diagnosis codes. I mentioned earlier in previous slides some reimbursement methods that's in the United States healthcare system that contribute to decreasing cost. It's a government's way. And such things as pay for performance. It's a CMS initiative that establishes the reimbursement based on providers' performance scores that are participants in Medicare and Medicaid. And the government also funds or provides incentives or financial incentives for facilities and healthcare providers that apply for and adhere to CMS guidelines and process measures to improve the overall quality of care. And facilities can actually be penalized for not following such initiatives as pay for performance. And then we have fee for service, which is less favored and is being phased out due to inconsistency in pricing. Fee-for-service charges for each individual test or treatment. And then we have PPOs and HMOs, managed healthcare organizations, where that is a group of hospitals or physicians that are participants in that healthcare system for insurance reimbursement. And then the patients can only go to those certain specific participants to seek out healthcare needs and treatments. With the new mandates set forth by the government, the Patient Protection and Affordable Care Act, all citizens are mandated by the government to obtain health care insurance, either provided by their employer or through public insurance, such as the Affordable Care Act, or through government agencies such as Medicare and Medicaid. As I have mentioned in the previous slide, there are differences between private and public insurance programs. Managed care organizations and HMOs and PPOs are groups of healthcare facilities that participate to provide care for a group of individuals with a prepaid set amount. And then we have the U.S. Bismarck model of healthcare is jointly funded by the employer and the employee by payroll deduction for a nonprofit organization. And then, as I mentioned, the employers are now required through the Affordable Care Act to provide or offer insurance to their employees for full-time employees. Through the HCA Act that was enacted on March 23rd, 2010, many hospitals and medical facilities face challenges and barriers to remain accredited and receive insurance reimbursements and to avoid penalties through the government. All of these processes can be very costly to healthcare organizations. With the implementation of HCA, over 34 million citizens in the United States are now required to get health insurance, and this also creates an influx of patients seeking medical attention and not enough providers, and is adding to cost in the healthcare system that was not predicted and prepared for this new onset of patients introduced into the healthcare system. So how does technology affect cost in the healthcare system? Well, with all these government mandates, they impose challenges onto medical organizations to implement new systems such as the electronic health record or e-prescribing. Medical organizations can face or have structural, environmental, geographical barriers present for the implementation of new technology. In 2010, the federal government, or CMS, mandated the use of electronic health records to improve communication, lessen time documenting, and allow clinicians more time with their patients. The use of the electronic health record was also implemented for better reporting methods to meet quality initiatives set forth by CMS. Meaningful use or electronic health record implementation is to improve the overall quality of care and to help clinicians with better diagnosis codes and better systems to meet ICD-10 codes and support their clinical documentation of the care that was provided. When this mandate was set forth, the government also provided incentive payments for all CMS medical provider participants who comply with the implementation of the electronic health record in their medical facility. In 2012, the federal government mandated that all prescriptions be electronic or computer-based. The goal of this initiative, set forth by CMS, was to improve communication between healthcare providers and pharmacists, to improve the overall quality of care, safety of medication dispensing, and to reduce time and obviously cost, and allow the government to be able to monitor, or the facilities to be able to monitor and audit their own systems, and to be able to improve upon the delivery of their services from extracted data from the e-prescribing system. And then another form of technology that adds cost to the United States healthcare delivery is the electronic disease registry. This disease registry is utilized by physicians or medical providers to retrieve information or data that's related to diseases or medical conditions, and also can assist the physicians to make a better decision on treatment methods. All of these government initiatives are driven by many factors to meet quality initiative, to reduce overall cost, and to help facilities improve their communication and to improve the overall quality of care that they provide to stay in business and to remain competitive in this healthcare arena. The implementation of the electronic health record adds millions of dollars of cost to each medical facility and presents a lot of challenges to medical facilities to implement and continually change and update policies and procedures to support this electronic health record. CMS set forth the initiative to encourage the use of evidence-based medicine, assist medical providers with reporting their quality initiatives, and endorse CMS's pay-for-performance reimbursement plan, and improve the discovery of beginning disease states, and further improve and monitor medical insurance abuse or dishonesty. The top 3 benefits of the electronic health system are to timely access medical records. Several providers can access the same record at the same time without waiting to look into a chart. Improve the delivery and dispensing of prescription refills, and as I mentioned in the previous slide, to improve communication between healthcare clinicians
and medical providers. Medical equipment and diagnostics also add cost to the healthcare system. Medical equipment is very expensive, and with new technology needs constant upgrades, and new technology is constantly introduced into the healthcare system. The implementation of new devices and medical equipment costs facilities to buy the equipment, but also to train, educate, and to continually monitor and change processes cost medical facilities money and can add and contribute to financial burdens. Diagnostic equipment such as MRI and mammographies, CT, and ultrasound are very expensive pieces of equipment, and it takes a highly trained and highly educated individual to operate and take care of patients for this equipment. And then another cost is a highly necessary area is medical research. Medical research is mostly privately funded, but the goal of medical research obviously is to improve patient care and delivery of treatments and to ensure the safety of the United States population. The U.S. Healthcare System, Part 3, the U.S. versus Canada, an international perspective. My goals during these next few slides will be to discuss, review, and describe the Canadian healthcare system and their method of delivery, and to review the Canadian Healthcare Act, make a brief comparison with the United States healthcare system, and give some positive and negatives regarding the Canadian healthcare system. So, how does the Canadian healthcare system operate? Well, it is governed, regulated, and funded by their federal government, and the Canadians know their system to be Medicare. It is a publicly funded insurance model. It is considered to be a socialized health insurance plan. The federal government and one of the 13 provinces or territories pays for the insurance or the medical care of the citizens. The Canadian Healthcare Act in 1984 was implemented to ensure equality amongst all citizens in Canada. The 5 elements of the Canadian Healthcare Act are universality, or to provide coverage to all citizens and to provide the same quality of care. Comprehensiveness, which means that all citizens will be fully insured. No premiums or deductibles necessary for all deemed or necessary health care treatment. And hospitals, dentists, doctors, and specialists are covered by the Canadian Healthcare Act insurance. Another element is portability, which means that a citizen can move or relocate and get services from another territory or province. And then to be overseen by the government or public administration, that the insurance will follow all government rules and that they will be a nonprofit organization and that they will be subject to audits and have open records to the government. And then the last element of the Canadian Healthcare Act is accessibility, that all citizens have access to healthcare and that all medical providers or physicians will be adequately compensated for their services. Now, citizens are covered by the federal and provincial or territorial insurance, but they are also entitled to buy private insurance. And employers offer private insurance as a benefit. This private insurance will cover such things as vision, outpatient prescriptions, and physical therapy perhaps, and other items that are not covered and considered a necessity by the government. So now I will discuss some positive and negatives or pros and cons of the socialized insurance. One of the most positive points is that everyone is entitled to health care and that everyone will receive the same quality and care and treatment, and that the physicians are compensated and paid in a reasonable amount. Another positive is that all citizens or patients have a choice of primary care doctors, hospitals, and clinics in their province or territory. So the federal government pays the physicians or hospitals, but the patients have a choice of doctors, hospitals, or clinics, or dentists. Some of the cons or negatives of the Canadian healthcare system are that the patients are forced to see their primary care doctor prior to seeing a specialist, unlike what we know of as a PPO insurance in America. And that choice has been taken away. Treatments must be deemed as a necessity by a physician. So one cannot just choose to go see a specialist. And there may be long wait times associated with special procedures or diagnostic tests such as an MRI or ultrasound. And that the con is that there's a lot of strict federal rules that the medical providers and hospitals must adhere to get reimbursed. Now I'm going to discuss what is similar, or is it the similarities between the U.S. and Canadian healthcare systems. We are all aware of the Patient Protection Affordable Care Act, otherwise known as Obamacare. This is the U.S. government's attempt to be similar to socialized medicine, or what is known as Medicare in the Canadian government. The quality of care is equal or the government wants to provide a good quality of care here in the United States, and that the insurance is made available to the public, and that in private insurance cannot discriminate or prevent someone from getting insurance now in America, such as a pre-existing condition as in the past. And then the Obamacare requires citizens to obtain insurance. Another similarity is that half of the Canadian physicians are primary care or general practitioners. And as we learned, over 60% of the United States doctors are primary care physicians or general practitioners. In conclusion, I provided a brief overview of the Canadian healthcare system and how it operates. And I've discussed some of the positive and negatives of the Canadian healthcare system, and also have given some comparisons to Obamacare and the Canadians' Medicare system. Part 4. Healthcare Reforms and Improvements. The most recent healthcare reform, obviously, is the Affordable Care Act that was introduced. And again, this was an intent by the government to regulate the healthcare industry to protect citizens and to ensure that all citizens are entitled to healthcare insurance regardless of pre-existing conditions. This new regulation and reimbursement methods obviously compels hospital providers to become more cost efficient to stay in business. The most recent healthcare reform was mandated or implemented effective on January 1st, 2015, requiring all companies or employers to offer healthcare insurance to their employees. This applies to all businesses that have more than 50 employees in their business. The most recent healthcare reform in the state of California is obviously to support the federal mandate of the ACA. The California Association is called the California Healthcare Foundation. This foundation was obviously implemented to support the healthcare reform and advances and improve the effectiveness of California's public coverage programs. This allows for state oversight of the insurance industry and the ability for the state to be able to monitor and produce reports of how many people have become insured over the last year and that are continually joining or enrolling into the Affordable Care Act insurance or introduced into the Medicare or Medicaid system. The California Healthcare Foundation supports Medi-Cal and other publicly financed covered programs and assist with improving primary care physicians and specialist services and access to these programs via Medi-Cal program, and obviously to improve upon the quality and the cost of health care delivery. The California Healthcare Foundation also works with all of the key stakeholders, which are physicians and anyone involved in the healthcare system, to create and implement new approaches for managing care and managing Medi-Cal patient costs, especially with the increased need of medical attention for the elderly, permanently disabled, and now the younger obese population will be creating a new onset of higher comorbidities for physicians and medical providers to deal with. The foundation's goal is to support the California state citizens by developing easier enrollment processes and to provide citizens with the best healthcare options or insurance packages, to ensure better access to physician and clinics, and to look at new payment and reimbursement options for healthcare providers, with the main goal of improving the quality of care and to reduce costs. And again, to provide more information and to support all stakeholders in the medical system. And stakeholders would be people such as policy creators or political campaign leaders in the industry, the payers, insurance companies that reimburse, the providers for billable services. And of course, the most important stakeholder would be the patient or the California or United States citizen. Healthcare improvements, mergers and acquisitions. Well, the newest healthcare improvements obviously are led by the federal and state government mandates, and this has led to challenges faced by medical providers and healthcare facilities. But the overall goal and end result is to provide better patient care and to have improved patient outcomes and to be more efficient and effective in treatment modalities and methods, and to provide consistency with care. And then another improvement is the introduction of the ACA, and that is to improve the quality and the accessibility of healthcare. And that should be the future focus of the United States healthcare system, is to provide access, to provide more providers and specialists into the system. The need to build more clinics and emergency room departments has risen. And another improvement is the introduction of the electronic health record for capturing diagnosis codes and reportable data for meaningful use, which allows clinicians to spend more time with the patient and less time at the computer, and also improves the overall quality of care by improving communication between healthcare providers. Another improvement is new regulation set forth by CMS to reduce admission rates and for reimbursement of Medicare and Medicaid patients. Conclusion, the future of U.S. healthcare. Where are we going to be in the next 5 to 10 years? What is in the future for the United States healthcare system? The federal government is creating a path for this country to have a form of socialized medicine or insurance. I predict the need and the demand for more hospitals and clinics and healthcare support people, especially medical providers or more physician assistants and nurse practitioners to support the millions of people that did not have medical insurance that are now in the healthcare system. And of course, the focus should be to improve the overall quality, effectiveness, and efficiency of the healthcare delivery system. With the rise in obesity in our adolescent or youth population, and their lifespan will be shortened, and more comorbidities for this generation will exist that include heart disease, diabetes, and stroke. And then again, we'll need more providers to support the elderly baby boomer population and their chronic illnesses just from being elderly, such as heart disease and high blood pressure, lung disease as emphysema or COPD, and then cancer. The need for more clinics will lessen the burden on the emergency rooms departments and the emergency room physicians and staff. I also predict advances in medical research, especially related and pertaining to integrative medicine techniques and improvements in medical equipment and computer technology. According to Beninsky, Hayes, and Vanel 2014, medical tourism will become more popular to Americans to reduce the cost of care. They can get better quality of care by going to other countries, foreign countries, to have their care delivered due to the limited resources here in the United States. With the increase of citizens now having insurance and not enough providers to take care of them. Also, Beninsky, Hayes, and Vanel mention that there will be advances in technology such as quantum computers that will have the ability to share information and data with the healthcare team and globally, and improve the communication to provide better care and a more uniformed way of providing care for specific diseases or ailments. And in the next 5 to 10 years, we will see an increase in home care or more people being treated at home with better technology and resources for healthcare providers with the home equipment, like being able to monitor them on a closer basis by computer technology. And this will allow for better quality of care and improved communication between healthcare providers and patients. and medical facilities. Many factors have played a role and have influenced and shaped the way that the United States healthcare system operates and how providers are reimbursed and the overall quality of American healthcare delivery.